leading cardiologist from India, shares his experience of more than 2,000 cardiac procedures. He did his training in Moscow and the University of Ohio, U.S.
I'm Director of Department of Cardiac Surgery. I had my medical training here in India, and then I moved to my academic training in cardiac surgery to the Bakulev Institute of Cardiovascular Surgery, Moscow. And then I did a fellowship in cardiac surgery from University Hospital, Uppsala, Sweden, 1999. Since then I have been working. This is a long time, and we grew as the institute grew, and we tried to gather all the technology which was coming up in Western Europe and Northern America. And those technologies includes robotic surgery, minimally invasive surgery, beating heart coronary artery bypass surgery, keyhole surgeries, likewise. I've been to a couple of places in North America, and particularly for the robotic surgery, I got my basics from University of Ohio, where I got a basic robotic surgery, and then I went for my practical training to the Midland, Odessa, and then to University, the Atlanta, St. Joseph Hospital. Also, I have been visiting frequently to like Cleveland Clinic, NYU, Texas Heart Institute, and in European arms like in Netherlands, Utrecht, which from where the beating heart coronary artery bypass surgery started. And I also got some basics in the robotics in the University Utrecht, Netherlands. Then also I had got some training in fact I spent a lot of time in University Hospital Uppsala, Sweden, where I learned aortic surgery, coronary surgery and valve surgery. I did visit University Hospital in Paris and in Gad Hospital, London, and King's College Medical Center, London. So these are various places where I could able to know more and more advancements which are occurring in the field of cardiovascular surgery. But then I utilized those knowledge here in the Scott Heart Institute, and I could able to do more than 12,000 cardiac procedures. That includes around 1,600 port access surgery, which is that mitral valve repair and replacement, aortic valve replacement, ASD closure, cardiac tumor removal, and also coronary bypass surgery. I must have done around more than 6,000 beating heart coronary artery bypass surgery. Today I do around 20% of my surgery from overseas patients, and those patients, they come basically from countries like Iraq, Afghanistan, from African countries like Nigeria, like Botswana, like Kenya, like some other small countries from Africa. We do get some patients from Western world. I have operated some of the patients from United States, very few, not much, some from Western Europe. But we do get some of the patients from Middle East, and most of the Indians who settle in Middle East and Far East, and some of the patients from Canada, from USA, but mostly those are the Indian patients, Indian origin people who are settled in those countries. But our bulk is now from Iraq, Africa, Afghanistan, Bangladesh, and few patients from Far East and Middle East. Stage we have got 350-bedded cardiac facility, which includes 9 operating rooms, 5 cath labs. We have MRI, we have dual head CT scanner. We have then a state-of-the-art lab which is managed by the Religare, SRL Runback Religare. And then we have extremely talented, trained manpower, both in cardiac surgery, cardiology, intensive care, and in anesthesia. That's the backbone. Not only that, we have extremely trained, dedicated paramedics.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.